I want to start with a question people rarely ask, and I need you to answer it honestly, to yourself. Do you feel a sense of apprehension or even anxiety at the thought of going to the bathroom? Have you ever felt that sharp pain, that burning sensation, or seen that bright red blood that instantly sparked panic without ever daring to mention it to anyone? Not even your doctor? If so, listen to me carefully. You are not alone, and above all, you have absolutely nothing to be ashamed of. It's estimated that nearly half of all adults will deal with hemorrhoids at some point in their lives. It's a silent epidemic. And because the topic is taboo, millions of people suffer in silence, rely on ineffective over-the-counter creams, and ultimately make their condition worse. Today we are dissecting this issue. We aren't just going to talk about symptoms. We're looking beneath the surface. I will explain the exact mechanics of your pelvic floor, why our modern lifestyle is destroying your blood vessels, and how precise clinical and natural protocols can restore this area. I am Dr. Marcus Thorn. Grab a pen. Let's dive in. Before we discuss solutions, we need clinical clarity. There is a major misconception I see constantly, even among some healthcare professionals, confusing hemorrhoids with anal fissures. Let's be precise. An anal fissure is a physical tear in the mucosal lining. It's a cut. Hemorrhoids, on the other hand, are a vascular problem. Anatomically speaking, we all have cushions of blood vessels in our anal canal. They are supposed to be there. They act as seals to help control continence. The problem starts when these veins are subjected to excessive biomechanical pressure. They become engorged with blood, stretch, lose their elasticity, and eventually sag or swell. Think of a balloon that has been overinflated and simply refuses to return to its original shape. But where is this pressure coming from? There are the obvious culprits: being overweight, pregnancy, or lifting heavy loads while holding your breath. But there are two insidious causes that modern medicine often underestimates. The first is our modern posture. Biologically, humans evolved to defecate in a squatting position. When you squat, a key muscle, the puborectalis muscle, completely relaxes, creating a straight canal. Today we sit on toilets at a 90-degree angle. That muscle remains partially contracted, creating a kink in the rectum. The result? You have to push, you strain, and that constant force crushes your blood vessels day after day. The second cause is the health of your liver. This is fascinating. The venous network of your rectum is directly connected to your portal vein, which travels right up to the liver. If your liver is congested, inflamed, or fatty due to a poor diet, that pressure backs up directly into your hemorrhoidal veins. It's pure hydraulics. Clinically, this pressure manifests in 3 distinct stages. Let's identify which one you're dealing with. 1. Internal hemorrhoids. These are located above the dentate line on the inside. You don't have pain receptors up there. The classic symptom? Bright red, painless blood on the toilet paper or in the bowl. It's terrifying the first time you see it, but it's purely mechanical. 2. External hemorrhoids. These form under the skin, right at the opening. This area is highly concentrated with nerve endings. The result is intense itching, a feeling of heaviness, and a burning pain. 3. Thrombosis. This is the painful emergency. Blood pools in an external hemorrhoid, coagulates, and forms a bluish or purplish clot. The pain is searing and sharp, often preventing you from even sitting down. It is your body's warning signal of acute, localized inflammation. If you are suffering right now, here is the exact protocol, grounded in human physiology, to diffuse the crisis and prevent relapses. 1. Fiber engineering. The right kind. You're always told to eat more fiber. But that's incomplete advice. Insoluble fibers, like wheat bran, can act like sandpaper on an inflamed canal. What you actually need are soluble fibers. They form a soothing gel. The best clinical tool for this? Psyllium husk. 1 tablespoon in a large glass of water daily. This will lubricate your digestive tract from the inside out. 2. Natural vasoconstriction flavonoids. To restore structural tone to your veins, science points directly to 2 compounds extracted from citrus fruits, diosmin and hesperidin. These bioflavonoids reduce capillary permeability and increase venous resistance. When taken as supplements during a flare-up, clinical studies show a significant reduction in both bleeding and pain. 3. The topical protocol, what to apply. Forget harsh chemical creams that dry out the skin long term. Opt for witch hazel. It is a powerful natural astringent. Applied on a cold compress, it literally shrinks swollen tissues. Combine it with pure aloe vera gel to extinguish the inflammation. 4. Biomechanical modification. This is non-negotiable. Elevate your feet when you are on the toilet. Use a small stool about 6 to 8 inches high. This simulates the squatting position, relaxes the puborectalis muscle, and eliminates the need to strain. 5. The 3-minute rule. The bathroom is not a library. Do not bring your phone in there. The longer you sit on that hollow seat, the more gravity pulls down on your pelvic veins. 3 minutes maximum. If nothing happens, get up and walk around. In my practice, I see patients making their own cases worse with a few simple mistakes. Aggressive wiping. Dry toilet paper creates microlesions. Use a bidet, a hand shower, or unscented water wipes. No alcohol, no fragrances. The painkiller trap. If you take codeine or opioid-based painkillers, you are going to paralyze your digestive system. The severe constipation that follows will be much worse than the initial pain. Ibuprofen for bleeding. Ibuprofen is an anti-inflammatory, but it also thins the blood. If you have an internal hemorrhoid that is actively bleeding, ibuprofen will only prolong it. Stick to acetaminophen. If after 10 days of this clinical protocol the inflammation hasn't subsided, we have excellent tools in the office. These are very quick outpatient procedures. Rubber band ligation is the gold standard. We place a tiny band at the base of the vein, it dries up, and falls off in a few days painlessly. We also use infrared coagulation to sclerose the tissue. Major surgery is strictly a last resort today, but here is my clinical warning. The red line. Not all rectal bleeding is a hemorrhoid. If you are over 45, if you notice a sudden change in the shape of your stool, such as very thin, pencil-like stools, if you are experiencing unexplained weight loss or chronic fatigue, you must see a gastroenterologist. Never assume that blood in your stool is benign. It is one of the earliest signs of colorectal cancer, which is highly treatable today if caught early. A simple colonoscopy can save your life. Do not let embarrassment stop you from getting an accurate diagnosis. Your body is an interconnected system. Your rectal veins are a direct reflection of your posture, your hydration, and the overall inflammation in your body. Treat the root cause, not just the symptom. Stop suffering in silence. Apply the science. If this investigation helped you understand your biology, subscribe to the channel. Share this video with someone who might need it, even if you do it discreetly. Take control of your health intelligently. Until next time.